Hello, everybody. Welcome. Thank you all for showing up tonight. We have an exciting slate of presenters who will be speaking to you all. My name is Brian Elgart. I am a fourth-year medical student at UNC Chapel Hill in North Carolina, and I'm currently serving as the Medical Student Interest Group Officer as a secretary. It's my pleasure to be the moderator for tonight's webinar. We are honored to have the following AMSSM members serving on our speaker panel: Dr. Amy Powell, Dr. Rosemary Agostini, Dr. Monique Burton, Dr. Shelley Street Callender, and our 4 inaugural medical student grant recipients, Akman, Jessica Buttinger, Andrew Nowak, and Dante Zanders. So we would like to begin tonight's presentations from our immediate past president, Dr. Amy Powell, and longstanding AMSSM charter member, Dr. Rosemary Agostini. So Dr. Powell, you have the floor.
Hey, good evening, everybody. Thanks so much for being here. And it's an honor to be a part of this great group. So I was given a few minutes to kind of give a little bit of background on the grant that my husband Neil and I decided to start to honor Dr. Agostini. And I thought I would just start by telling you a little bit about my story, because it kind of helps to explain why Dr. Agostini is so important to me. So I grew up in Western Washington and went back east to college, but did medical school and residency in Seattle at home. So I chose to do a primary care internal medicine residency at Virginia Mason Medical Center, which is where Dr. Agostini was practicing at the time. And I did that because I knew with 100% certainty that I wanted to be a primary care general internist in Seattle for the rest of my career. And it turns out that life throws you curveballs. So as part of a primary care internal medicine residency, I was forced, I guess, to rotate through the practical fields, even in my intern year. And so my first orthopedic rotation was with Dr. Agostini. And I loved it. I loved the approach. I loved the motivated patients. I loved the hands-on use of the physical exam to actually accurately make a diagnosis. And I totally fell in love with it, but I didn't know it quite yet. So then I elected to rotate again with Dr. Agostini, maybe late in my intern year or early in my second year, and then literally again, probably sometime else in my second year. And it was by maybe my third or fourth rotation that she said something like, you kind of seem to be interested in this. This is my recollection. She can fill in all the things that I'm probably lying about. You kind of seem to be interested in this. Would you consider doing a fellowship? And I said, no, I mean, I can't. I'm an internist. That's a family medicine thing. She said, no, you're wrong. And let me show you the way. So basically created a fellowship worthy candidate and paved the way. And it is without any exaggeration at all that I would not be here without her. And so she has been a mentor, not only through the fellowship process, but through the first 2 decades of my career. And it's been a real honor to get to know her now as a friend, in addition to as a mentor. So moving on to talk about Dr. Agostini. So she was the very first primary care sports medicine fellow in the US back in the mid 80s. So how about me for being in the right place at the right time with someone who had all that experience? She has a heart for social justice issues and underserved communities. And she never told me this, but you could always tell just based on her actions. So just as a couple of examples, she single-handedly created a process for team physicians in Seattle public schools when they needed care, not because she got any financial benefit from it, but because the kids needed care. She was part of a community organization, Walk with a Doc, where less walkable neighborhoods were paired up with law enforcement and physicians to basically build community through exercise, just little things like that, which are big things. I don't want to minimize their importance. So I saw that both as resident and then as an early attending, and I'm like, wow, this is amazing. So at any point along the way, if I could give back to somebody who's meant so much to me, that's kind of what I wanted to do. And so the kind of, why now, why the grant, why this time? I think a couple of reasons. When good stuff or even bad stuff happens in your life, you have an opportunity to be a little bit introspective, right? So you get to think about what you want to do and how you want to do it. And so being elected to the president role for AMSSM was one of those moments. And it was so fun just to be able to think about collectively, like where we're at in sports medicine, where we've come from, where we're at, where we're going. And I feel like one of the most remarkable things is that when you sit in a room, for those of you who haven't done it yet, hopefully you'll come next year. But when you sit in a room at an AMSSM annual meeting and you look around, you're like, wow, this group looks very different than the athletes that we take care of. And we all know that there's good research supporting physician-patient concordance in race and gender. And I feel strongly, and I thought that Dr. Agostini might as well, that having a group of sports medicine physicians that look more representative of the athletes that we provide care for would be a good thing. And so why medical students? So one of the roles that I have here at Utah is teaching second-year medical students, and I love it. And medical students are smart and talented and energetic and are younger than me and able to reach a younger population of folks that may not understand that this is an attainable field for them. And so the opportunity to put a little bit of grant money, hopefully to light a little bit of a fire to have students reach into their communities and do something super creative that I couldn't think of, and maybe Dr. Agostini would, but I couldn't, was a really nice opportunity. And it's been a real honor to see what's happened with this so far. I think there's excitement moving forward for what this grant is going to allow people to do moving forward. And I think it's good for our whole organization, but our whole field, our whole area of specialty. And so that's kind of the story. And with that, I'll turn it over to Dr. Agostini.
Thank you. Amy, I just want to say how overwhelmed and thankful I am. I would like to start with my most sincere thanks to Dr. Amy Powell and her husband, Neil, for this extraordinary honor. My thanks also include the American Medical Society for Sports Medicine, and especially Joan Brown, who helped me with my presentation, Doctors Monique, Shelley, Naila, and medical student Brian. It brings me great joy and gratitude to learn of the work of the medical students, Jessica, Andrew, Alex, Dante, and their mentors. What the sports medicine physician gets to experience on the sideline, in the locker room, and in the community is often profound appreciation for our work. Slide can come down, and no slide, just me. To share a bit of my journey and passion around working in underserved communities, my medical training was in a 6-year BSMD program in New York City. The focus of the biomed program was on how culture and ethnicity affects a person's healthcare. I quickly understood, even as a medical student, the language of sports was a key to talking with people who do not trust doctors or have access to healthcare. My journey has been an incredible one of mentors and people and opportunities. And as you saw in the first picture, that was Dr. John Bergfeld, who has been an amazing role model for all of us, and especially Amy and myself. The expectation of a sports medicine doctor at Cleveland Clinic included volunteering not only during their sports medicine fellowship, but for the rest of their career. The high school I worked with after my fellowship, and for 21 years, Cleveland High School in Seattle, Washington, a very poor high school who often only had 20 players on the football team. The football players were Vietnamese, Samoan, Black, and mixed race. I provided not only game coverage, but free physicals and an adult on the sideline who cared. I eventually headed up a program that put athletic trainers in all 10 Seattle public schools and coordinated the volunteer team physicians. At the 1996 Olympics, I worked in the Athletes Village Medical Clinic and provided care for athletes who came from countries that were too poor to provide their own medical teams. A slide, please. There we go. At Group Health, I was given an award titled Tomorrow Medical Leaders and started a program named Walk and Talk with Your Healthcare Team with Dr. Kim Holland as my partner. Next slide. We started the program in a neighborhood that recently had a number of drive-by shootings. We needed to provide a safe place to walk with a group of seniors. One of my most critical messages to you all today is that one never knows whom you mentor or cross paths with, who they will become. John Diaz, next slide, a cop on the street, eventually became Seattle Police Chief. Amy Powell, as you know, became the president of the American Medical Society for Sports Medicine. To help with our walk and talk with your healthcare team, I called Chief Diaz and asked for a community police officer to walk with us every Friday at noontime. His answer was yes. And for almost 4 years, every Friday at noontime, our group had an officer in uniform walk with us. We created a safe place not only to walk and talk, but built a safe place for community members to have conversations with officers and officers to have conversations with community members. I look forward to medical student Jessica, Alex, Andrew, and Dante's presentations this evening. And I completely agree with Amy that giving people the opportunity to be creative is sometimes what you get back is so much more than you actually expected could be possible. Their work will be a great pathway to increasing minority students' knowledge of sports medicine as a career. Next slide, please. And as I was saying, this is, what the equity and what justice is going to be, and we want that for all of the people we work with. Thank you to my husband, George Brooks, in support of all my work, and all the people who donated to the Agostini Medical Student Community Outreach Fund. Again, thank you, Dr. Amy Powell, for your recognition and honoring my life's work and passion for supporting equity, justice, and health in underserved communities. To all of the American Medical Society for Sports Medicine members, the Subcommittee on Diversity, Equity, and Inclusion, the staff, applicants, and you, the awardees this evening, congratulations on the work done. Together, and you can take the slide down, please. Together, we make a difference. Thank you, Dr. Powell, and everyone participating this evening.
Thank you, Dr. Powell and Dr. Agostini, for those impactful presentations, and truly for everything you both have done for AMSSM and the students and your communities. Your work has been greatly appreciated. I would now like to turn the floor over to Dr. Monique Burton, who serves as the chairperson of the DEI subcommittee that is within the membership committee. Dr. Burton.
Well, welcome. It's good to see everybody, and welcome, and thank you for having me tonight. And I think that you'll hear some similar themes. I don't have any slides, so I'm just going to talk to you for a little bit, but I was kind of like had some things in mind that I was going to say, and I was part of this really interesting presentation today where we were really thinking about past traumas and how that impacts us, like as people of color and just as people in general, and like how we're able to, as healthcare providers, be able to take that into account. And as I was sitting here also listening to one of the people several people on here who I think of as mentors, I paused for a moment. I thought wow, some of what I want to share is really more around how we as medical professionals can take all that into account and how we can serve as inspiration, because I've been inspired by several people who are here. So just real quickly, I'm going to tell you a little bit about my experience. So I, like many of us, probably went into sports medicine because I was an athlete and got injured. And everyone, when I was growing up, was always take 6 weeks off and you'll be better. And that didn't work very well. I was a gymnast, and for one, I didn't listen. And another, that actually doesn't work. So sometimes, but so I met somebody who was my sports medicine physician in the community, and was just like, wow, this is what I want to do. I knew I wanted to do pediatrics, and that's my primary specialty. And I had never heard of this sports medicine. And he was one of the early providers, Dr. Stephen Rice. And I was like, I'm going to do that. And I went to medical school, and they said, no, you have to be in family medicine. You can't do that. And I said, okay. And I kind of didn't believe them. Luckily, went into residency and was told again, I don't think actually could do that. Like, and also, by the way, we want you to kind of focus on infectious disease or cardiology or whatever, and not that. And luckily I met Dr. Cindy Chang, who let me like intern with her. And I didn't know how amazing she was actually until I went to my interviews and people were like, how do you know her? So, but again, the theme is here, like people inspiring me and that she took a chance on me. And then was able to do my fellowship. And actually, like I ultimately made my way back to Seattle. And well, so first of all, before that, I met Amy when I was doing a rotation in Utah for my sports medicine fellowship. And then I came to Seattle and I met Rosemary. So it's just amazing how all the people who are here like served as touch points. But what I will say is that when I first started and within AMSSM, there's a pretty small meeting room. And I would literally like look around the room and be like, yep, there's just a few people, one of which was Shelley. And it struck me, but I also am aware that the reason that there were not that many people of color is that if you really think about our medical schools, the amount of people of color that there are, and then you bring that into residencies and people's desired specialties, and then you subspecialize it, then there's just not as many people. And so in thinking about that, like, it's great to take who we have already and encourage people to go into sports medicine. But I think to make a really big change, we need to inspire people who are younger. And what struck me when I was doing during COVID, and I had to switch up a little bit what I was doing because sports weren't happening. I started doing primary care again, which was challenging and fun. But I also, when I did that, one of my questions I always ask is about what people what they want to be when they grow up. And a couple of things that struck me about doing primary care again is that I literally almost had somebody on a regular basis when I was in our community clinic say, I've come to you today specifically, which scared me because I was like, you don't know that I haven't done primary care for like 10 years because you're a woman of color. And I want my child to see a woman of color. And I thought, wow, okay. Thank you. What an honor and what an amazing responsibility I feel like I have to make sure that I live up to the expectation that I have also been given by you. But it touched me and was remarkable to me every time I heard that. And then I would always ask what people wanted to when they grew up without a lot of pressure. But it was amazing to me how many people would say they want to be in medicine. And then I felt kind of yucky because I was like, that's amazing. And I don't have anything for you specifically. And I really wanted to be able to say, great, come to this, like, like, what can I do? And, remove barriers of like volunteering and all the logistics you have to go through. So it really kind of brought me into like, the pathways are so important, right? Because it's that comment, and it was comments that people made to me when I was younger about medicine that inspired me. And those people who took a chance on me, who gave an opportunity. So when I think about pathways into medicine, I think about all of our responsibilities, and even the little comments or the questions that we ask inspire someone who's like in elementary school, and that comment carries over. And if we are able to provide an opportunity where they can, come in and like listen, they listen to their heart with your stethoscope, or they put on a bandage, and then they like use that to launch off their inspiration, and they have opportunities in elementary, in middle, in high school, in college, in medical school, then each of those kids then can serve as mentors as they go through their various steps. Then we've actually truly like started to impact a change. So Rosemary's done this. I knew this because I got the opportunity to work with her and heard about all the amazing things that she's done. And I think it's so special that we have the grant in her name and all of you here who've done this work. And I can see how it will provide that opportunity. And what I guess I'll just kind of say in the end is that just the other day, I started doing a movement clinic to really help kids to be active, sort of the opposite of what we do in sports medicine a lot. But I've been struck by, I still ask that question because I find it very important, and I'm in my community clinic. And now I feel more excited because the other day I was asking someone and she said, I want to be a pediatrician like her pediatrician, because she kept me healthy and she's inspired me to help other kids. And I felt like for the first time, as I will say, like, I'm going to write down your name because we have a program that we're going to do later this year. And I would love for you to come. And so I am excited about this, the growth and to see where all this goes, because I think we're going to be able to inspire so many younger people who will then be able to tell their stories and be able to encourage others to get more people of color into our sports medicine community as well, so that when in several years down the road, when we look at the physicians for the USOPC or the whatever it may be, that we are like, wow, our providers look like our athletes. And that's so important because we know that it's so important that we see people who we can identify with. So I probably can talk a lot more, but I will pause because I love to hear your presentations. And thank you for letting me be a part of this panel.
Thank you so much, Dr. Burton. We appreciate your speech and your work in increasing diversity in the medical field and in sports medicine. I would now like to introduce Dr. Shelley Street Callender. She is the co-chair of the AMSSM Education Committee, co-chair of the AMSSM Diversity Special Interest Group, and leader of the Scholarships and Grants Working Group of the DEI Subcommittee. Dr. Street Callender, the floor is yours.
Thank you. It's such a privilege to be included. And thank you to both Amy and Rosemary for allowing me to actually work on this grant and have this opportunity. And congratulations to Brian, Jessica, Dante, and Alex, and Andrew, right, who also got it. We were so impressed by your applications. There were a lot of applications. I think all of the applications were worthy. And so our goal, I think, eventually is to give as many as we can so that the work can continue. I will share a little bit in that I came into sports medicine a little bit different. And so one of the goals when we talked about the subgroup discussing how we would put this grant application together is we wanted to bring more people into AMSSM, but also into the sports medicine community. And if we limited it to our medical students who are only members of AMSSM, that we might actually miss a good group of people in a number of communities for all the schools that don't have clubs or don't have knowledge about sports medicine, which is where my background came from. I am internal medicine and pediatrics. I did a Med Peds residency. I played sports like many other people have in the past, and I played during college. Basketball was my sport of choice. And when I went into medical school, I didn't really think about sports medicine as an option. I actually wanted to be a pediatrician and ended up loving internal medicine and thought that might be the field, and then still enjoy pediatrics, so did Med Peds. But when I went into my Med Peds residency in Detroit, Michigan, there was no one who had ever done sports medicine in our internal medicine program, nor our pediatrics program. And we had a freestanding children's hospital. So I was actually the first person to do that. And I was encouraged by my program director and associate program director, who both had never done sports medicine either, to pursue that field. We were very big. It was very highly encouraged to be in the community in Detroit. So our Med Peds residency actually became mentors to one of the inner city Detroit schools that was down the street. So all of the residents, or most of the residents, had a high school student that was your mentee, that would come to clinic sometimes with you, that would shadow you, that would hang out with you, that would learn more about medicine so we could introduce them to medicine and hopefully spark them to go into this field. And my student was a girls basketball player. And so she asked me to come to her game, and I said, sure. So I came to a few of her games and enjoyed it. And eventually, long story short, I became their team physician as a resident. And as I went through residency, I continued to do this. And at the end of residency, my my program director was like, well, you're going to be chief resident next year. What do you think you want to do? And I said, well, I'm not quite sure. I think I want to do general internal medicine and pediatrics. And he said, well, have you ever thought about sports medicine? And I said, I don't think I can do that. And he was like, you can actually do that. And he said, and you're kind of already doing that. So maybe it might be an area of interest. And so as we went through this application, I wanted it to also be accessible to students from across the country and the US, that to be able to reach back into their communities, because we gave to this inner city in our community in Detroit, and this wasn't something that was accessible, and I would want it to be accessible to all. So the next year, we're hoping to be able to award even more grantees. The deadline is going to be March 1st. It will be through the AMSSM website. You do not need to be a member of AMSSM. We will become a member if you aren't. It is sponsored by one of the reviewers or one of an AMSSM current faculty. Your faculty member does not have to be an AMSSM sports medicine physician as well. And we wanted the application to be something that was easy and obtainable to busy medical students, but also something that encouraged collaboration and reaching into your communities in which you live, work, play, study. And with that, I'll turn it over to the next presentation, because I'm excited to see everyone's work as well.
Thank you, Dr. Street Callender, and thank you for helping get this grant application process off the ground and started for its inaugural year. So now it's my pleasure to introduce our 4 inaugural medical student grant recipients for 2022. Alex Akman, who is a 3rd-year medical student at Georgetown University School of Medicine. Jessica Buttinger, who is in her 4th year of medical school at Central Michigan University College of Medicine. Andrew Nowak, who is also in his 3rd year of medical school, also at Central Michigan University College of Medicine. And Dante Zanders, who is in his 4th year of medical school at Mercer University School of Medicine. Each of them will now present a highlight of their community outreach projects and program events that they implemented with their grant funding. Starting with Alex, you have the floor.
Thank you so much for that. Let me pull up my PowerPoint real quick. So my name is Alex, and I'm a 3rd-year medical student at Georgetown University School of Medicine. I'm in Washington, D.C., and that's where I'm from. So I have a long history. I'm very connected to the community, and seeing this grant was the perfect opportunity to get involved. And so for my project, I partnered with an organization in DC called Open Goal Project. And their slogan is to even the field and change the game. It's a DC-based organization that was founded in 2015. It was started to eliminate barriers for low-income families and underserved communities to access high-level soccer opportunities and empower players and their families to overcome obstacles by offering free programs to players who were previously kept on the sidelines. They work to clear paths for young soccer players to access opportunities for growth on and off the field, regardless of their socioeconomic status. And it uses soccer as a vehicle for cultural enrichment, higher education opportunities, and greater life experiences. And sort of by the numbers, so you can understand the organization and the community which I worked in. They serve about 150 children. They were ages 7 to 17. 99% of participants identify as African American or Latino. 80% of student athletes have parents who have never attended college or university. Greater than 50% of the children are immigrants or are children of immigrants or immigrants themselves. Greater than 60% have never stepped foot on a college campus. And then 2 stats I don't have, I would say around 50% English is a second language, or they're not fluent in English currently. And access to healthcare is very limited. Either they're underinsured or not insured at all, and rely on community clinics. So their interaction with physicians is very limited. So Open Goal Project, they have 2 directors, 2 lead coaches. They have 5 program assistants, 1 trainer, and 1 supplemental program leader. They lead clinics 2 to 3 times a week. And then they have different programming, like soccer symposiums. They have Friday night lights, museum tours in the city. They have art for Open Goal, and they have a lot of educational enrichment around their programming as well. So I think you have the same scarf on right now, Dr. Agostini.
Yes, yes, I do.
I stole a picture from the internet, but your
Thank you.
grant, as you know, is asked to develop a community program or event to encourage young people from underrepresented backgrounds to consider medicine and a subspecialty in sports medicine specifically. And I sort of lined up the goals of AMSSM and Open Goal. And they pretty much were the exact same goals, just delivered through different methods. So I thought it would be like the perfect partnership for me to team up with them. So for my project, I plan to create sort of 3 little seminars integrated into their curriculum to get them excited about sports medicine, develop hands-on experience and skills in medicine, make connections, interact with physicians, and learn pathways into the fields. So my first step was just to lead a session on what is sports medicine, what's it like to be a physician, what's the way to get there, are you interested in a field in healthcare, why are you interested in that, and really just, it was a way for me to test the waters and sort of figure out what they were interested in. Step 2 was a CPR training. When I proposed the grant, because CPR training is expensive with equipment and certifications, I think I proposed initially certifying 15 students. So of the 150, I planned to work more with the older students when I created this grant. And then the third part of my project was to do a college visit with them, to take them to schools. I said 50% of them haven't been to a university, and we have 7 in the DC area, probably within 20 miles. So they just needed someone to be there to sort of take them and lead the way. And sort of through this presentation, I have QR codes. One links you to the AMSSM website, and the other links you to Open Goal Project, since I don't have a ton of time to talk about both, but you can find more if you scan those. And so for my project, once I got started with the seminar, I actually realized the little kids, like very little, really had a lot of questions and really wanted a lot of information. So my project sort of took a different direction. It's still heading the same route, but they were very interested in general wellness, how to treat sports injuries, how to prevent sports injuries, and nutrition as well. So probably once a month I would go to their field. We had met outside because of COVID, and we would lead little discussions. I made little handouts, PowerPoint slides, and the kids ended up bringing the PowerPoint slides to their parents, and we were able to get our presentation translated over to 2 different languages, so they could have it as well as resources, since they were sort of the people providing the food to their kids, just to create just general wellness at home. there we go. So my project sort of took a different route. As soon as the AMSSM annual meeting happened, I got a bunch of emails from people in my university or the DC area reaching out to me, which was remarkable because as a medical student, I feel like sometimes I'm cold calling people and sending out blank emails, hoping that I can get people to work with me. But for the first time in my medical school career, people were reaching out to me. I had faculty at my university. DC Fire and Rescue offered a Hands for Heart CPR, which is a compression only CPR training. They offered it for free, which was great. You don't get a full certification from it, but we were able to get some of the little kids involved and sort of stretch our budget out to hit as many people as we could. After that, we started getting into the seminars, sports nutrition, prevention, healthy living, which branched into a whole new thing of teaching the parents nutrition programs and wellness. The Open Goal Project led a resume workshop with some of the older students, how to prepare college applications, build a resume. And then people on campus started to reach out, varsity soccer coaches, athletic trainers, the strength coach at Georgetown. He said, bring your kids by and we'll do a big tour. So my little tour that I was planning just to show them the medical school campus has really, really evolved into something that's going to be really great. I haven't done it yet. We were waiting for their soccer season to end, so it'll happen in the next month or so. And then just like personally, I've grown a lot as well, and DEI at my school has reached out to connect the students with Georgetown mentorship programs. There's a linguistic and health barriers and research seminar, and we have something called Undocu Hoyas for undocumented Hoyas to get them involved. So it's really the grant and AMSSM has really opened doors for this project, but really for the kids. So I'm really thankful for everything that you've done. I want to thank the AMSSM, Dr. Rosemary Agostini. Simon Landau is the director at Open Goal Project. Dr. Amy Powell and her husband Neil, Dr. Monique Burton, Dr. Shelley Street Callender, the MSIG, Joan Brown, the DEI subcommittee, and my faculty sponsor when I submitted the application was Dr. Justin Molnar, who also works in soccer as a sports medicine physician. So thank you so much for your time, and feel free to scan the QR codes if you want to learn more about my project and Open Goal Project. Thank you.
Thank you, Alex. Thank you for your work. Now I'd like to turn the floor over to Jessica for her presentation.
Okay, can everybody see this?
Yes, we can see it, Jessica.
Awesome. All right. Well, first of all, I just wanted to say thank you to Dr. Agostini, Dr. Powell, Dr. Callender, and Dr. Burton. And thank you so much for sharing your stories. I think I can speak for all of us on this call that it's very inspiring just hearing, how this all came to be for each one of you. And we're so grateful for this opportunity and for this grant. And congrats to the other grant recipients. Amazing work, and Alex, great presentation as well. So for my presentation tonight, and for what I did with the grant, it was a Night of Sports Medicine, a partnership between the Health Careers Pipeline Program and CMU College of Medicine. And this was made possible through the Agostini Medical Student Community Outreach Grant. So a little bit of background. So the partnership with the Health Career Pipeline Program, I thought it was a great fit because this program is designed as a community partnership between several high schools in the area, CMU, and then the Mid-Central Michigan Area Health Education Center, or AHEC. The mission for this program is to recruit a diverse group of 9th and 10th grade students interested in pursuing a health profession career. The program is offered to a broad representation of schools in mid-Michigan, and they're all living in medically underserved, rural or urban areas of mid-Michigan, and they were all first-generation college students. The three main pillars of this program are mentorship, teaching, and health and wellness. Under the guidance of health profession student mentors, high school students explore career options, engage in hands-on clinical simulation experiences, and learn how to navigate the post-secondary environment to achieve their goals. They become more observant of their own health and wellness in this 8-week after-school program. And then with the help of the Agostini Community Outreach Grant, we were actually able to do a night of sports medicine. So one of the 8-week courses was dedicated to a sports med night. And as you can see in this picture, this was the start of the night. So it was with all the students participating in this program. And you'll see Dr. Bermudez, he's on the far right. He's a family trained sports medicine physician in the community. And then Toby Blosser, he's an athletic trainer in the community. And both of them I selected to be part of this panel as they both have experience both working in high schools and colleges and even at the professional level. And really, when I was thinking about this grant, I wanted to partnership with a program that was already really ingrained in our community. And I felt like this was a really good fit. So, you know, when I leave CMU College of Medicine, this can continue. And that was really huge for me as I wanted to establish a presence that we could continue the sports medicine night. I also really wanted to highlight that I feel diversity is important in all aspects of sports medicine, both at the position level and at the athletic training level. And as we both know that it's super important to get diversity in athletic trainers as well. So I really wanted to have an athletic training perspective here. And what I really learned through this process as well is that in athletic training, you have to have a clear idea of the career path before you even get to college, because a lot of times those athletic training programs, they start in their first year of college. So I thought this was a perfect fit for these 9th and 10th grade students to get those exposures. And so here we did a panel discussion. We went through the steps of, you know, what it takes and the coursework that is involved in getting into both college and then beyond in athletic training, as well as medical school. And there was a Q&A session as well, which was definitely a highlight. I loved hearing some of the questions from the students. And then after that, we had dinner that was provided as well. And then we had a casting clinic. And as you can see, Dr. Bermudez on the left, he's going through how to cast, and the students had opportunities to cast each other. And he was going through some of the indications for why you would, you know, cast a splint an arm. And then here's some more pictures of the students. It was definitely a highlight. They loved to cast each other. And then just from a personal experience too, I wanted to highlight for me after we finished the session, it was pretty amazing. I had a group of females coming up to me and they all said to me, you know, we're really interested in going to sports medicine now. We're so excited. And coming for me personally, and I'll share this experience, is that I didn't have a female sports medicine physician until I was in college. And for me, that's very important, just diversity in all aspects. And so it was very, it was like an incredible experience to have them come up to me after that and say that to me. And really the takeaways from this experience is the importance of immersing yourself in the community where you practice medicine. To truly understand your patients, you really have to be involved in that community to understand as well. You always want to be helping to pave the way for others that are following you, as Dr. Agostini has done, as Dr. Powell has done, and Dr. Callender and Dr. Burton. You guys have paved the way for us, and we're so grateful. And then finally, it's just to remember everyone that helped you on your journey and to provide that same support to others. And through this program, I'm a mentor to these students, and so they can reach out to me with questions and I'm available to them. And I think about where I'm at, and it's only because of everyone that was mentor me. So this was a very important experience to kind of reflect on that. So finally, I want to thank you for Dr. Amy Powell and Dr. Rosemary Agostini and the incredible grant opportunity. Thank you for your commitment and lifelong service to underserved communities. And then a special thanks to Dr. Angel Bermudez and Toby Balser for taking the time to volunteer at this special event. And if anyone has any questions, thanks so much.
Thank you, Jessica. I would now like to turn it over to Andrew for his presentation.
Great. Can everybody see that all right? All right. First, we'd like to thank the AMSSM and Dr. Powell and Agostini for making this event possible. I also want to thank my team who helped make this day happen. They are the reason why this turned into an amazing program. A few of them are on this call tonight, so thank you, Kayla Johnson, Brittany Hamama, and Gabrielle Kennelly. And finally, thank you, Dr. Almaria. Without your help and inspiration, this program would not have been possible. Our program is entitled A Day in Sports Medicine, and we helped introduce 8th through 12th grade students to the entire sports med team and the process involved in having college athletes ready on game day. Attending students included some members from the Saginaw Chippewa tribe, as well as other individuals underrepresented in medicine. We believe our program served as a platform to introduce these students to sports medicine and give them a pathway forward, which I'll share more about shortly. This event also allowed us to create a space for medical students to get involved with and interact with populations underrepresented in medicine. We were able to pair each high school student one-on-one with a medical student volunteer who talked to them about sports, college, medical school, and anything in between throughout the day. In terms of the day itself, we had a full itinerary. We started with a meet and greet at the football stadium, and then students were given a tour of the sports medicine facilities by Dr. Amaria, who gave a full rundown of the space and the equipment. After the tour, students heard from an athletic trainer, physical therapist, and Dr. Amaria. Each explained a bit about their schooling and the roles on sports med teams caring for athletes. Importantly, they relayed the importance of collaboration in their fields to optimize patient, and in this case, athlete care. Students also heard from the captains of the women's lacrosse team, who talked about her previous injuries and how the sports medicine team helped her return to the game. The head lacrosse coach also talked about working with sports medicine team to know when her athletes are ready to return to the field after being injured. Actually, later that day, we all got to watch the lacrosse team, the very player that spoke with us, make the game-winning goal in the very last seconds of the game to cap off our day in sports medicine. I swear I didn't write this script. I couldn't have made this happen. It's probably one of the most exciting sports events I've ever watched, and to do it with an awesome group was amazing. So in order to keep that energy going after a long day in sports was over, we partnered with the Area Health Education Center, who also provided swag, support, and lunch to students. And they also discussed upcoming community events that the students could get involved in. In addition, the students were told about and given a flyer with information regarding an awesome pipeline program offered by CMU to help students with college and graduate school, as well as to encourage them to sign up for Camp Med, in which you learn more about the field of medicine throughout the summer. Now, our goal was not only to make the day great, but to give these students a path forward to pursue a potential career in sports medicine. While I can tell you how amazing we thought the program was, I will instead read a comment from a medical student volunteer and one from a parent about the impacts of this program made possible by my team and the AMSSM. So from the medical student, it made me reevaluate the types of relationships and patient groups I hope to care for in my future practice. And from the parent, this was an amazing program. My daughter loved it and is now asking to learn more about a career in sports medicine. If anybody has any questions on how to make this happen at your university, please feel free to reach out. I'm happy to talk with you about it. And thank you very much for your time.
Thank you so much, Andrew. I would now like to pass the baton over to Dante, who will give his presentation.
All right, let me share screen here. All right, can everybody see this? All right. So first, let me thank Dr. Callender, and she may not know this. She was the first Black attending that I worked with as a third-year medical student, and I thought that was really something special to me because I am the only Black male out of class of 120 students. So the first time I was able to work with someone that looked like me, I just wanted to attach and hold to it, just hold on to it because like this is such a great moment. And I ended up asking her after my PEDS rotation, would she be my mentor? Because that's how much that moment really meant to me. And I'd like to thank the AMSSM for awarding me the grant. And also again, Dr. Callender for making me aware of the grant because I would have not known it or known about it if it wasn't for her. And so the organization that I work with is called Streets to Success. It's basically a Christian-based community center. And it's kind of funny, again, how I ended up finding about this community center. I was on my third year rotations, and one of my classmates said, hey, this nurse is trying to get in contact with you. Her dad runs this community center outreach program. And she says, hey, there are a bunch of young Black males, and I noticed that you were a Black male going through the emergency room. And apparently I stand out, and that's one of the things she said. She's really trying to get in contact with you. And she ended up getting my number, and we began talking. I was like, oh, great. Because one thing for me, I realized I never had this opportunity growing up in a small town. I was fortunate enough to grow with both parents in the house, but I never saw a Black physician until I was in undergrad. So that's something that really stuck out to me. So when I look at my kids, I look back at them like, hey, I remember being in this position. I'm trying to figure out, what I want to do, and asking them what they want to be when they grow up. Literally everyone, I'm gonna show you a picture, and everyone has said they want to be some type of athlete. And it makes sense because that's usually what they see. And representation really matters. And it's hard to see yourself doing something. It's hard to put yourself in a position to do something you've never seen someone that looks like you in that position. So that's why it really means a lot to me. And so again, the mission here, from Streets to Success, our mission is to love, tutor, and instruct young men and women in dealing with the challenges of life. And one thing I didn't realize until I looked at Neighborhood Scout, so this community center is on the corner of Houston Ave and Hightower, and literally it says 100% of adult residents in this area don't have a 4-year degree, and it's one of the lowest income neighborhoods in America. Just for these kids to make it out is a testament to the challenge they have to overcome and just to work through to get to this position. And so when I just started showing up, as you see, it says Wednesdays 4 to 8. I would just show up at first. There really was no plan. Basically just show up, see what I could do. And I remember talking to the director, he was like, yeah, just come through. We'll figure something out. And I would come through and I would tutor in math and English. And there's a big part where we just talked about, hey, what's the next step? Because right now, my kids usually run from the 3rd grade, and we have a junior in high school, and just, hey, what's the next step? Where do we see ourselves going from here? You're going to graduate, but what's next? We're going to middle school. What's next? How are we going to enter high school? And it just showed up, and I just literally just showed up and just started giving my time, because I think that's one of the most important things that you can give. And I remember talking to the program director, and he says, hey, money is good, but time is really what matters. And as a med student, I know everybody in med students and physicians here, we understand how important that time is. I would show up as soon as I got off of a rotation. I would be in scrub some days. I would have blood stains on my shoes, but I was there. And I think that really matters, just showing up for people, just showing that you care. And so on August the 17th is when I instituted the program for the grant funds. I was always trying to figure out what I wanted to do. And what I did was something that kind of impacted me. I took little things that I really liked. And of course, all my guys played football, and they were always coming like scratches and bruises on. And I had to try to think of a way to tie that into like what really interests them. And so what I did was one book I read every semester, at the beginning of every semester, is Dr. Seuss' Oh, the Places You Go, because I truly believe you have to keep that child imagination alive. And as you read it, the older you get, you realize nothing is more true than you being you than you. And I think it really guides people, and it guides me whenever I get down trying to figure out, oh, where am I going to go? What's the next step? And so what I also found was a first aid kit, which had a bunch of sports medicine items for my kids there. Like it had ACE bandages, wraps, antiseptic wipes. And I was like, okay, y'all always coming in here with these scratches and bruises. Let's figure out, how do we treat these? This is what you can do in the future. There are actually physicians that treat these particular type of injuries. You rolled your ankle. This is who you can go see, and this is how we do this. And we actually kind of did a little class later on. Oh, how do you treat? How do you splint? How do you how do you wrap an ankle? How do you do all these things? And I also put the lacrosse ball there because a lot of people don't realize lacrosse balls are really good for rubbing out sore muscles. And again, I have a bunch of athletes. And so I just try to tie these things into them that they didn't really think about in a certain way. And also I'll put the caduceus there because I said, hopefully one of the places you all go is to medical school and towards the sports medicine path. And I put in these backpacks for them so they can keep hold to them. They're little kids pretty much, you know, and they like tend to lose things. So, and that's how we ended up with that. Just some pictures of the event when I was there. And as you can see, these are my guys and this is me handing out the bags. Everybody just be sitting around the corner. We just had a talking session on like what our expectations for the year were going to be. We really wanted to focus on reading, writing, and math, because those are the big things that are tested these days. And so after that, I said, hey, I have these gifts for y'all. We're going to start just kick off right with a little gift and say, oh, the places you'll go. And again, this is us at the very end. Again, these are my guys. And it's one of the things that it kind of was sad because since I've started here and only been a year, we've lost three of my guys to gun violence. So it's something that's really important because a lot of these kids don't get the opportunity to make it out. So just me being there, just hopefully them seeing someone that looks like them, like saying, hey, medical school is an option for you. Taking the path towards sports medicine is an option for you. So it really means something to me because, again, as I said, I see myself in them. Always looking for somebody to like, hey, can I be a physician? Why do I have to be an athlete? And it's hard to, again, put yourself in someone else's shoes or see yourself in a position if no one ever looks like you. And that is the end. Oh, stop share.
Thank you for your presentation, Dante. And thank you to all of our medical student presenters, Alex, Jessica, Andrew, and Dante, for sharing what you did with the grant money and what you're doing for your communities. And I know that you all will continue to do that into the future as physicians. We do have a couple extra minutes for questions. If anybody has any questions for any of our speaker panel, feel free to unmute yourself to speak or throw it in the chat and I can read it to whomever you wanted to ask it to.
This is Rosemary. I just want to say how incredibly impressed. And Amy and I have been texting back and forth, and we just have goosebumps and we're grateful. And it's only a little bit of money. So we look forward to thanking each one of you for your incredible work. And then hopefully creating lots more grants and raising more money. And thank you, Amy. Thank you, everyone participating. Rosemary.
Thank you so much. I think we're all very excited to see where this grant continues because it's, you know, this is year one, and I think it's just going to be incredible to see what's going to go on.
There are no burning questions. Monique, did you have one? Sorry.
Oh, I wanted to ask, and maybe I'm not actually aware of this and need to ask Shelley, but I mean, these projects are so amazing. And one of the things that is at the top for like the DEI subcommittee of interest is around pathways projects. And I just think that what not a better way for you to educate us about what you've done and what's been successful and what has been your challenges, and you know, help us to like build something within AMSSM. And one of the things that we're really hoping to do, fingers crossed, if we can pull this together as a community project that would be part of our annual meetings. So I think it would be great to like learn from your experiences and have you be involved. I just actually, with Shelley and Amy, correct, I'm not actually sure how that works as far as involvement, but I mean, I would love to have you in our DEI subcommittee. So I think you have to be a member, though. That's probably the only thing, right?
I think it's just AMSSM membership, but I think, Shelley, did you say that the grant awardees are supported as members?
Correct. So all of the grant awardees are AMSSM members. And if they were not an AMSSM member when they applied for the grant or the award, then they became an AMSSM member. And this past year, one of the, there's a group of us that evaluated the applicants, and all of them, man, we wish we could have given out more in these projects to speak to how wonderful the ones that were chosen are. But though they were all sponsored by someone in that group if you were not already a member. So yes, you become a member if you were not a member. And if you are already a member, then obviously you're a member. So all of them would be eligible to be part of the subcommittee if they desired.
Okay. Well, if you desire, then send me an email, because I'm getting ready to send out our last meeting's minutes that we kind of took apart some of the work and put it back together again. And my attempt was to create less working groups, and I created another one, but it's just around pathways. So if you are interested, then let me know and I will add you to our email list.
I want to say, thank you all for applying for the grant. And we really appreciate your presentations. It's really exciting to see the inaugural group present and have such wonderful projects. And Dante, thank you so much for actually taking the call and going ahead and looking at it and applying as well. It's been such a pleasure to be your mentor.
Well, thank you, Dr. Callender. It really means a lot.
Well, to close us up tonight, I would like to thank everybody for coming. It's been a pleasure serving as the moderator and being able to hear the impact that everybody is making on our communities. I hope that someone else has been inspired by these presentations tonight, and that will motivate you, if you are a medical student, to apply for the grant, or if you are a mentor or a faculty member, to encourage medical students to apply for the grant opportunity next year, so that we can continue to have great projects in communities like we saw tonight. I'd like to again thank all of our amazing speaker panel for their presentations, and thank you everyone for attending. The webinar has been recorded and will be posted on the AMSSM YouTube channel and on the student page of the website. So again, thank you all for coming, and have a good rest of your night.
Thank you. Bye, everybody. Good night.
Bye, so good to see everybody.
Good night, everyone. Happy Thanksgiving.